guess when we're talking about the asymptomatic case rate like this, and then seeing these new cases come in, if you have any thoughts about, I guess, the collegiate reopening, the college campus reopenings.
Right. So, that, yeah, like I mentioned before, there's decent evidence suggesting that older kids are more likely to transmit than younger kids. And so when you look at our data, and many places in the country right now, we would estimate the asymptomatic prevalence in the 0 to 18 population of somewhere around 1 to 2%, right? And because that encompasses the whole range from 0 to 18, if the younger kids are probably a little bit lower than that, the older kids are probably a little bit higher than that. And so, if the asymptomatic prevalence in older kids is actually more like 2 or 3% in many parts of the country, then it's almost inevitable that if you get a group of 100, 200 kids together, living in dorms or going to parties, it's basically inevitable that you're going to end up with significant, super spreader events. And if you test all of them, you're going to find that many of them test positive. So I don't think it's a surprise at all. Knowing what we know about these numbers. There are some parts of the country, some counties, where we would predict that the asymptomatic rate is as high as 4 or 5% of kids. And right now in California, many of the counties in the Central Valley have had many COVID cases in the general population. And we're finding here that many of the cases that we're detecting of asymptomatic kids are coming from those populations in the Central Valley, and they match a lot of the same demographics and everything that we're seeing from the confirmed cases.
Is this a matter of course, the solutions we talk about have not changed since even late February, right, before we even got struck, of course, of social distancing, proper hygiene, and just, being cognizant of these symptoms and any risk of such symptoms. But if we talk about solutions in terms of testing and bolstered testing for younger populations, I mean, from my perspective, it seems like the testing has been stressed on working class adults or people who do have to commute for work, or in some kind of instance have to be around people out of necessity. We kind of negated the discussion, it seems, around testing children who have even less agency in a circumstance where they're going to be around people because someone's made that decision for them, right? Is this a matter of we really need to set up more established testing, routine testing for whole families?
Yeah, that's a great question. The CDC has recently really made recommendations about testing to move away from testing of asymptomatics, and structured a lot of their recommendations around people with the presence of symptoms. And so much of this is driven by having to manage testing scarcity, right? And we don't have the capacity to test everyone that we should and could be testing. And as a result, we're having to triage our testing and reserve testing for people who need testing more. And I would totally agree that if you have a limited number of tests, you got to test the people who are symptomatic, that you need to know about, that you need to treat, and who are at greater risk, which unfortunately leaves the asymptomatic children sort of last in line. But in an ideal world, we would have enough testing capacity to test all of these people. But when you are in a situation of testing scarcity and you need to allocate that scarce resource, then you do unfortunately need to allocate these, but that's not an ideal situation, and we're never going to get we're never going to get things under control if we're in that, as long as we're in that situation. But unfortunately, with with an asymptomatic prevalence of 1%, there's just no way practically that we can test enough people frequently enough that we can do anything about it.